Good afternoon. My name is Alexandria Thompson, and today I will be presenting an article published by Johns Hopkins Medicine on the communication disorder spasmodic dysphonia. The article explains the voice disorder spasmodic dysphonia, the different types of the disorder, causes, treatments, and what living with the disorder can be like. Spasmodic dysphonia is a voice disorder in which there are involuntary spasms in the muscles of the voice box or larynx. These spasms cause the voice to break and have a tight, strained, or strangled sound. It is a lifelong condition that most often affects women, and symptoms can begin between the ages of 30 and 50 and may include speech that is strained, weak, or breathy. While there is no known definitive cause of the disorder, there are a few theories as to what may happen. The suspected leading cause is a central nervous system disorder. Researchers also believe that the disorder may be inherited, or it could be caused by an issue with a part of the brain called the basal ganglia. Finally, researchers state that the disorder may occur after the cold or flu, a voice box injury, or prolonged use of the voice. Diagnosis for the disorder can be done by several professionals. A speech-language pathologist will test a person's voice production and quality, and an otolaryngologist, who is a professional specializing in the ear, nose, and throat, can diagnose the disorder by checking the vocal cords using fiber optic nasolaryngoscopy. There are 3 different types of the disorder. The first type is adductor spasmodic dysphonia. This type is the most common. It causes sudden, involuntary spasms that trigger the vocal cords to stiffen and slam closed. The spasms interfere with the vibration of the vocal cords, and stress often makes the spasms worse. However, the spasms do not occur when a person is whispering, singing, laughing, speaking in a high-pitched tone, or breathing in. The second type of the disorder is abductor spasmodic dysphonia. This type is less common than the first, and it causes the vocal cords to open. Since vibrations cannot occur when the vocal cords are open, it makes sound difficult. Open vocal cords also let air escape during speech. When air escapes during speech, it causes sounds to be weak, quiet, and breathy. The final type of spasmodic dysphonia is known as mixed spasmodic dysphonia. This type is extremely rare, and the symptoms presented with this type are a mix of the 2 previously listed. Since there are various types of the disorder, treatments can depend on a number of things. Treatment can depend on a patient's age, overall health and medical history, how sick the person is, and how well one can handle medicines, procedures, or therapies. This disorder is lifelong, and the goal of the treatments are to reduce symptoms of the disorder. Speech therapy, along with injecting Botox into the affected muscles of the voice box, are a few of the most common treatments. It is important for a patient to consult with a speech-language pathologist to determine what treatment is best suited for them. Living with spasmodic dysphonia is very difficult. People with this disorder have difficulty speaking, which can lead to stress and frustration. Because of this, it may be extremely beneficial for someone with the disorder to seek counseling, which can help them learn how to cope. Some other tools that may be helpful for these individuals are technological devices and/or apps that translate text into speech. With all of the advances made in technology, these devices and apps can be extremely beneficial in helping individuals who suffer from this disorder communicate. While there are no cures for the disorder, there are treatments and tools that can make living with it easier. Thank you for listening to my presentation.